Guys, good evening.
Hey, good
Right now,
evening.
Good evening.
Good evening. Good evening, everyone.
okay, right now, I will commence this discussion as part of our uh, clinical nursing subject. Here is our topic. To start, I'll share my screen. Our patient, a 78-year-old male patient with pneumonia, presenting his history of high blood pressure and his chief complaints with breathing difficulties, and he has fever also. Vital signs, as you can see, he has 94% saturation rate, 19 breaths per minute for his respiratory rate, and what I have said earlier, he has fever with a body temperature of 39 degrees Celsius. He was diagnosed by the doctor as having pneumonia, and his treatment is he is to be admitted to the ward for IV therapy. So his medications were stated as in this order, and as you can see, he has numerous medications right now with repetitive and ongoing same medications in the duration of a 24-hour day. As you can see, he has, for example, every 4 hours frequency. Some of the scheduled medications here are similar. So with this, regarding to this concern, I will give the first focus to our first presenter, Sir Adlai, who will be discussing about polypharmacy. Sir Ads,
Okay,
take the
okay, thank you,
floor.
Sir Jace. I will share my screen now. Given the patient's age and his high blood pressure and current diagnosis of pneumonia, he is at increased risk for polypharmacy-related complications. What is polypharmacy? Polypharmacy, it refers to the use of multiple medications, especially by the patient, and which is very common in elderly patients or elderly population. So, first the risk. So, there is increased risk of adverse drug reactions. The elderly patients are at high risk for adverse drug reaction due to physiological changes, right? So physiological changes that will affect the drug absorption, the distribution, the metabolism, the elimination, and even the excretion. So, for example, the combination of multiple drug medications, this will increase the likelihood of experiencing side effects, right? So another risk is the drug-to-drug interactions. So the use of multiple drugs concurrently increases the risk of interactions that can either enhance or decrease the medication's effect. So it will also affect, for example, the use of ibuprofen. We all know that it is an NSAIDs or NSAIDs, non-steroidal anti-inflammatory drug. So if you use it together with other medication, there is an increased risk of gastrointestinal bleeding. Okay, so another risk is the medication non-adherence. So what does this mean? The intricate process of managing multiple medication, I mean, it can cause confusion and non-adherence that particularly in elderly patients with cognitive or physical limitations. Do you agree with that?
Yes.
Yeah. So non-adherence can lead or can result in suboptimal therapeutic outcomes and increased risk of hospitalizations. So those are the risks that are associated with polypharmacy. Now we will go to the considerations in gerontological pharmacy. First is pharmacokinetics and pharmacodynamics. What is pharmacokinetics? Pharmacokinetics is the study of how the body affects the drug after administration, while the pharmacodynamics, this examines how the drug affects the body. Okay, so there are age-related changes. So elderly patients, they have, due to changes in their body composition, these changes the effect or the drug absorption, the distribution. And also, for example, the patient is taking the enoxaparin and allopurinol. So this require dose adjustment in patients with reduced renal function. So this is very common in the elderly patients also. So very important to regularly monitor the renal function of these elderly patients. Another thing is adverse drug reactions. So what are the medications of the patients? Ibuprofen, amlodipine, and enoxaparin. So this can also cause GI bleeding sa yung ibuprofen or renal impairment. Another adverse drug reaction for the amlodipine, they can cause peripheral edema, which may be more pronounced in older adults. Another thing is enoxaparin. There is also a risk of bleeding. So especially with patients with renal impairment. Another consideration is the drug-to-drug interaction. For example, the ibuprofen and enoxaparin. The combination, this increases the risk of gastrointestinal bleeding and other bleeding complications. How about the ibuprofen and amlodipine? NSAIDs can reduce the antihypertensive effect of amlodipine. So this will lead to uncontrolled blood pressure. And the last drug-to-drug interaction is the allopurinol and antibiotics. So allopurinol can interact with certain antibiotics. So increase also the risk of skin rashes. So how do I do this? Okay. Next one is medication adherence. Okay, so the patient is on complex medication regimen with multiple dosing times, which can also lead to confusion and non-adherence. And it is also very important to regularly monitor the blood pressure, the renal function, and other signs of gastrointestinal bleeding is very crucial too. So it's also important to educate the patient and the caregivers about the purpose of each medication. So the patient has plenty of medication, so it's very important to explain the potential side effects and the importance of adherence. It's very essential also. And the last part is I have my notes here also. de-prescribing or reviewing the necessity, regularly reviewing the necessity of each medication and considering de-prescribing those may no longer be needed. Okay, so higher risk and benefit is important in managing polypharmacy in elderly patients. So that's it. Hope we get some points there. And
Yes,
this
of
time I
course.
will pass it to the next presenter, my friend Junji, for the assessment of functional capacity.
Okay.
Thank you. Thank you. I will stop sharing now.
About the case of the patient, 78 years old, that
Hmm.
diagnosed with pneumonia. So, assessment of functional capacity. First, we tackle the overview. Um, Under this is to evaluate the ability of the elderly patients on how he performs. It means that by this independent mobility, it divided into two: the activities of daily living and instrument activity of daily living. Later, I will explain when those ADL and IADL. Next is the importance of functional capacity in improving the health and quality of the elderly to maintain their being independent to achieve their life as they grow as they getting older. So here is it: determine the level of independence, identify the needs of assistance, and planning appropriate intervention to maintain and improve their quality of life. Next is the key areas of functional assessment. Under this is activities of daily living. That activities of daily living um, is the most basic. It's the most basic task that needed for personal care, such as bathing, dressing, eating, toileting, and walking. And the other one is the instrumental activities of the daily living. It is the complex task that allows people on how they function in the community, such as shopping, cooking, managing finances, taking medication. And then next is the mobility and physical function. This mobility and physical function deals with individual on how they move and how they perform their personal activities like gait and balances and strength and endurance, and how they walk ability, how to balance and maintenance, and how they use their physical strength, their muscle strength in their daily life. And then cognitive function, um, it refers to the mental ability of how the patient, on how the person thinking, their memory and their judgment. For example, like taking medication and having finances. And then nutritional status, it covers the body intake on how the person to maintain healthy body and weight to avoid undernutrition and malnutrition. And lastly is the social support. Social support is very important because relationship and connections with significant others, like for some friends, families, and neighbors, will reduce the loneliness and isolation, which improve the overall well-being of a person. Under the standardized assessment tools, one is the Barton Index, which measures the performance in basic ADL. Second is CATS Index of Independence in ADL, which assesses the 6 basic ADLs. This is maybe the 6 basic ADLs: the bathing, dressing, toileting. And then next is the Lawton IADL scale, which evaluates the performance of the IADL. This is also the examples. And then the time up and go, which assesses the mobility, balance, and fall risk. And the second assessment tools is the clinical observation or direct observation of the patient. Like for example, direct observation on how the client or how the elderly performs independently in ADL or IADL. And then the second is patient and caregiver interviews. And lastly is the specific consideration for the 78-year-old patient. Um, so as the age increase, it brings a significantly impact to the life of a person. So as we older, our body deteriorates. Like for example, is the pneumonia. The pneumonia that's diagnosed with the patient can cause breathing difficulties and fatigue weaknesses, which can affect also the activity on how this client perform their daily activities. The breathing activities, they reduce physical function, endurance limitation, and decrease ability to perform daily tasks. Second is the mitigation effect. Previous slides, Mr. Adlai discussed about the polypharmacy on how it will affect the status of the client in taking too much medication. Like for example, if during the drug interaction, ibuprofen can cause bleeding, amlodipine, dizziness. These are the side effects in enoxaparin. And then next is the too much drugs harmfully affect also the thinking of a client, also the thinking and judgment, and can cause confusion. And the comorbid is hypertension that requires careful management and potential impact on functional capacity. And last is the potential cognitive impairment. This refers to the decline in mental abilities such as thinking and judgment. So important consideration of a healthcare professionals is: one is careful and thorough assessment of a healthcare professional; two, close monitoring of patient having cognitive function; And third is identifying the condition as early as possible, such as dementia, depression, because the early in identifying this problem is the better to provide adequate or appropriate treatment. Okay, that's the end of my topic. I will end my screen, and the next presenter is uh, Tina.
Okay, so here it
Take
is.
your
Can you see it
time.
now?
Yes, you can.
Yeah. Okay. So I will discuss to you regarding the assessment of nutritional status with our client, with the case of our client, 78 years old male, with the case of pneumonia. So first is we need to discuss the importance of the nutritional status, which is crucial for the immune function, muscle strength, and the overall health, especially in elderly clients recovering from pneumonia. So the things that we need to consider are the key areas to assess. So the first thing is the dietary intake, which include the food and fluid consumption, the appetite, and the eating habits. And the second one is the anthropometric measurement. So we need to make sure that we get the body weight of the client, including the BMI, the muscle mass, and the fat distribution. Yeah, specifically. And the next one is the biochemical markers, which is the blood test for the key nutrients, such as example of that is we need to assess the muscle mass and the fat distribution. So the clinical indicators that we need to give importance, most especially with our client, is the muscle wasting, the edema, and the skin changes. So regarding the functional status, we need to assess the activities of daily living and the instrumental activities of daily living, such as preparing meals, if they can do it, like if they
Miss Tina,
can.
maybe you
Yes.
can try to zoom in and zoom out. Yeah, that's it.
Yeah.
Switch the screen a
Okay.
little. That's
Sorry
it.
for
Thank
that.
you.
Yeah, so we need to make sure if the client can participate in performing the activities of daily living and the instrumental activities of daily living as well, which can impact their ability to prepare and consume meals, for example, and then if they can take their medications independently, or if they can do the simple things at home when they are alone, like that. So the next one is the functional status. Yeah, I mentioned it already. And then the psychosocial factors, which include their social support and mental health, including their appetite and eating behaviors. So after that, we need to consider the specific factors regarding which is the impact of his pneumonia on his nutritional status. So the following effects or the reasons are the impact of pneumonia on nutritional status is increased metabolic demand and reduced appetite and difficulty swallowing. Okay. And then after that, there is also the medication effects, which if the client is taking antibiotics and anti-inflammatory drugs, the side effect of that can cause gastrointestinal side effects such as nausea and vomiting and diarrhea, which can affect nutritional intake and absorption. It can include also the hypertension, which it causes high blood pressure to the patient, which require dietary modifications such as the client should reduce the sodium intake, which need to be balanced with overall nutritional needs. And the last one is the comorbid conditions regarding the polypharmacy. By managing multiple medications can impact appetite and nutritional status, necessitating careful monitoring and adjustments. So that's it. I hope you understand my report regarding our clients. Okay, so I'll
Yeah,
pass the
it was
next.
very clear.
Yes,
Thank
thank you.
you.
So I will give the floor to Ms. Leandra. Thank you.
Okay, thank you, Ms. Christina. I'll share to you my screen. Next is our topic is gerontological considerations. So when managing these 78 years old patients, we need to adopt a gerontological approach to address both the broader aspect of his care and his specific needs. So under the comprehensive assessment, we have here the chronic disease management. For the chronic disease management, there is hypertension and pneumonia. So first, in hypertension, we should monitor the blood pressure closely to prevent the cardiovascular complications. We have to also to monitor and adjust the antihypertensive medications such as, for example, the amlodipine medications of the patients. Next, for the pneumonia, we have to administer antibiotics, which is the cefuroxime. Then we have to monitor also the current diagnosis and ensure that the patients provide the supportive care to ensure the recovery of the patient and avoid complications. Next is the functional and cognitive assessment. So under the cognitive functions, we have here the assessment tools that we are using. The MMSE or the mini mental state examinations and the MOCA or the Montreal Cognitive Assessment. This assessment tool ensures the patient that they follow the treatment plan effectively. Then under the depression and anxiety, we have to assess the conditions of the patient using the tools, using the GDS or the geriatric depression scales to assess the depression and anxiety of our patient. Then next is the advanced care planning. For the advanced care planning, we have a directives preference and palliative care. So under the directive and, preference, we have to um, discuss with the patients and ensure that the directives, we have to ensure that advanced directives are in place. We have to respect also the patient medical treatment and end-of-life care wishes. In palliative care, we have to consider also if the conditions worsen or other comorbidities are arise. Then, for our specific conditions based on our patient, we have then for the respiratory functions, we have to monitor the oxygen saturation of the patient. Since the patient oxygen saturation is 94%, which is slightly below the normal. So we have to continue monitoring the patient oxygen saturation rate, and we have to provide a supplemental oxygen if needed, or as the patient as the patient's need. Then next is the patient has a breathing difficulties also. So we have a bronchodilators like salbutamol and we use also the bronchodilators. For example, the salbutamol sulfate to use in patient difficulty of breathing. Next is for pain management. For pain management, we have to regularly assess the patient pain levels and treat it with the medication. So some of the medication that we use is the ibuprofen and paracetamol. Then we have also a non-pharmacological interventions that we use to manage the pain. These are the physical therapy and relaxation techniques, such as we also use the heat and cold therapy to manage the pain of the patients. Then for the nutritional support, we have a hydration and nutritional supplements. So under the hydrations, to prevent the dehydration of the patient, we have to monitor the fluid intake of the patient, especially if the patient is having a fever or the respiratory failure. Then for the nutritional needs, we have to provide oral supplements or fortified foods to meet the nutritional demands during the recovery of the patients. Then for our rehabilitations and physical activity, here we have a physical therapy and the activity level of the patients. In physical therapy, we have to engage the patients in program that regain their strengths and prevent deconditioning. For the activity levels, we have to encourage the patient to do physical activities or encourage light activities to promote the recovery and well-being of the patients. So by addressing all of these gerontological and patient-specific consideration, we aim to ensure that the holistic recovery of the patients are met to enhance the patient's life and plan of safe discharge. So for the next topic, it will be discussed by JC.
Okay,
Thank you.
things that we have discussed earlier boils down to a comprehensive care plan of this 78 male who is rushed, who went to the ER to present himself with those specific chief complaints, and of course as nurses. And the point of this case analysis is to present a nursing care plan somehow based on the based on the numerous focus that we have mentioned earlier. So just to have a recap, our patient who is 78 years old, a male, has a history of has a medical history of hypertension, and his chief complaints were breathing difficulties and fever. His vital signs, of course, as mentioned earlier, are these, and then the doctor diagnosed him pneumonia. Treatment is, he's admitted for IV therapy. And then we will now proceed to a sample nursing diagnoses. So we have 5 diagnoses here. We have impaired gas exchange. I'm sure we are all familiar with these diagnoses. Ineffective airway clearance is, as mentioned by his rate of breathing, his RR is again, this is related to his somehow assuming diagnosis, which is pneumonia, which has potential to have complications with his breathing. The third one is hyperthermia. He has a temperature of 39. Yeah. And the risk for decreased cardiac output. And the last would be the risk for imbalanced nutrition, less than body requirements. So let's proceed to the pneumonia, as evidenced by a saturation rate of 94%. In this case, since we are dealing with a gerontological patient, maybe our goal should be like 95 or higher. And then we could achieve this by doing these interventions, which has the following rationales. Administer supplemental oxygen to be specific. Monitor oxygen saturation levels using a pulse oximeter. Position the patient in semi-Fowler's or high Fowler's position. Very familiar. Encourage deep breathing and coughing exercises. So the rationales would be, of course, for the oxygen to improve oxygenation, alleviate hypoxemia or progressing hypoxemia, or worsening if ever. And then the second one is to ensure adequate oxygenation and detect any changes in respiratory status. Then the position of the patient should be, of course, changed to improve and enhance the gas exchange. Okay, and then encourage deep breathing and coughing exercises, of course, promote lung expansion and clear secretions. So our expected outcomes are these. Of course, 95% or higher autosat, and he will demonstrate improved respiratory function, and the patient would report ease of breathing. For the second one, related to respiratory infection, of course, pneumonia, the goal is to have his airways clear and his breathing patterns effective. I'll show you the interventions, rationales, and the outcomes. So we have to encourage fluid intake, adequate fluid intake, perform chest physiotherapy, I'm sure you're all familiar, percussion, postural drainage as needed, perform suctioning as needed to remove secretions from the airway. So potentially he could have that, he could have those findings, and to prescribe bronchodilators or ventilators via nebulizer. So we have the collaboration with the doctors, of course, to prescribe these medications as long as the doctor's order is given. Okay, the rationale would be to help thin, of course, mobilizing clear respiratory secretions to maintain clear airway and prevent obstruction, and to open airways, reduce mucus viscosity because of the medication that was given. Outcomes, okay, demonstrate effective coughing and clear lung sound. So the patient has to have these airways cleared. Third one, hyperthermia because of the fever related to the infection. Again, the goal maintain a normal body temperature and interventions specifically. Well, let's collaborate with the doctors, of course, as prescribed antipyretics, cooling measures, the TSB, tepid sponge bath or cooling blankets. Then regularly monitor the patient's body temperature and the laboratory. I mean the laboratory results, including elevated white blood cell count. Okay, for signs of infection. So these are the rationales. There you go. Yeah. Identification. Okay, for the outcomes, the patient maintains normal body temperature and the patient reports relief from symptoms of fever. For decreased cardiac output, we have the goal. I mean, of course, it's related to his hypertension, and the patient will maintain a stable blood pressure and heart rate. The interventions, again, nursing, medical, collaborative, we should do these regularly monitor the vital signs, administer the medications as mentioned earlier, antihypertensives, monitor for signs and symptoms of heart failure. So it's related to our nursing diagnoses, risk for decreased cardiac output, educate the patient about the importance of medication adherence. This one's important because we're dealing with the case of an old person, aged person. So we have to empower the patient to manage his condition. And the outcome, as expected, should be the patient should have stable blood pressure and heart rate within the target range, depending on his age. I mean, he's 78 years old. The patient adheres to medication regimen. So the patient adheres to medication regimen, and to empower the patient to manage his condition, because of the nursing interventions we did, he should be at least motivated to help himself. And then the last one is risk for imbalanced nutrition less than body requirements. As I mentioned earlier by Ms. Tina, it is related to illness and decreased appetite. Well, depends. A lot of older folks have difficulty with this. Goal, the patient will achieve and maintain adequate nutritional status. This one's important. Interventions and rationales conduct through thorough nutritional assessment. Very important. Refer the patient to a dietitian. Well, collaboration again. Assist the patient in planning balanced meals. Well, these are all related to each other, but very specific. So some of the rationales, proper meal planning ensures adequate nutrient intake. We should track the progress, make adjustments as needed. Supplements can help meet nutritional needs. Well, of course, depending if what kind of supplements these are, and some of the medications should have a prescription. And the last one is to maintain hydration and support overall health. Well, I'm just repeating myself here, but I'm sure we all get the idea. And the most important, the patient maintains a stable weight, okay? And the patient consumes a balanced diet. My topic, as part of the nursing care plan, we always should have the evaluation. And for the 5 diagnoses, the first one would be the patient maintains an oxygen saturation level of higher than 95% or 95%. And then the patient has clear airways, of course. He would achieve this 95 if he has cleared airways, and then the hyperthermia would change to a would be lowered or lessened in terms of the temperature, body temperature, and then his risk for decreased cardiac output, he will maintain a stable blood pressure and heart rate within the target range, depending on his age. And this imbalanced nutrition would be corrected. I mean, the risk for imbalanced nutrition. So this is just a potential, but we should avoid still. We should intervene still to avoid the risk for imbalanced nutrition. And for the follow-up, schedule regular follow-up appointments while assuming this is still a nursing intervention to monitor progress and adjust the care plan as needed, and educate the patient and family about medication adherence. So this is not a concern for just the patient alone. We will, as nurses, we will empower, we will make sure that the patient is motivated to be independent somehow with the help of the family, of course, and the nursing and the medical team. Since in the very first place, he came to the ER, right? So this is our case, guys. Just a very simple presentation of our case number 4 of our patient. Remember that managing the care of elderly patients, especially those with these kinds of cases, require comprehensive, of course, and multidisciplinary approach. So this one's very basic. I'm sure most of us here have experiences regarding these kinds of cases. Very common in the Philippines.
Yeah, yes,
I'm sure we don't know how
Yes,
to handle
pneumonia.
this one, but we have to do this like systematically organized, So by the,
Yeah.
how do you say this? Our backbone of nursing is the nursing process at
Mm.
PAI.
At PAI.
So that's
Yeah,
what we did. We developed a nursing care plan.
To you guys, how does pneumonia impact the functional capacity of elderly patients?
Once the patient has a condition, like for example pneumonia, patients have having a difficulty of breathing, and then it will able affect the daily activities for a 78 years old client on how he function in by himself without having a condition. So this pneumonia is greatly affect day-to-day basis.
Right? So in elderly
Mm.
patients with this kind of issue, the polypharmacy, how can we help them as nurses or doctors or the healthcare personnel?
Maybe we can help them by simplifying the medication regimen. Using pill organizers. They have that pill organizers that has
Yeah,
IM.
Dosette.
As yeah, for my experience, since we can help also the elderly by doing the dosete.
Mm.
So we have the AM in the morning. We put the
Right.
label. Yeah, AM in the
Yes,
morning.
yes.
Also, same with my father also, and my parents also, and my husband who has a lot of medication. So in order for them not to forget all the medicines that they should take every day, from Monday to Friday we have 7 7 containers.
Very often.
We have the AM medicines and the PM medicines. So weekly,
Very good.
for example, Saturday we started
Refill.
to organize the medicine. Saturday, so we put all the medicine for that week, so that they were able to we will not forget their medicines that they have to take every day. So
Mm.
these are the things that we have to do also to our patients in order for them to in order for them that the medicine should be organized and should be that we assure that the patients will take all the medicine.
Maybe also we can.
Mm.
It's very important to provide clear instructions also. Maybe not to the patient, but also to the SO
No.
or the significant others.
Yeah.
And
Yes.
purpose of each medication.
Yes.
To avoid
We should
confusion.
also educate also the family
Yeah,
members.
families, yeah.
Yeah, the patients. We can put a note also that we can put maybe on the ref magnets near the kitchens.
Yeah.
Then maybe after their meals, they can
Yeah,
they will not
reminder.
forget because it's in the front of their tables. It's a
And
good
I
thing
think
also
only
that we
people
have
who
notes
have
there.
time.
Okay, that's nice.
Nice, nice.
So
Mm.
guys,
Nice
do
answer,
you
yeah.
have more questions or clarification? Or you have more questions for anybody who's listening out there watching this presentation? You could look at those references, okay? You could open those sites. So guys, if you have any other questions or just want to clarify some things, maybe you want to present it now. So far, so good. Nothing?
I think nothing,
Could
yeah.
we call it a night?
We're so good.
Thank you.
Yes,
You
yes.
have something more to say? Nothing.
Thank you.
Nothing more to say.
Thank you so much.
Okay. So guys, thank you for this active participation, okay?
Yes.
Thank you, everyone.
Thank you,
Thank you,
guys.
Thank you. Good night.
Bye-bye.
Another
Good
moment
night.
na.
Bye.
Anan.